good afternoon, and thank you for joining us for today's senior telephone town hall on the district's response to COVID-19. My name is Tomas Talmonte, and I'm the Deputy Chief of Staff for Mayor Muriel Bowser. Today, you'll hear shortly from Mayor Bowser, our Director of Health, LaQuandra Nesbitt, our Director for Homeland Security and Emergency Management, Christopher Rodriguez, and our Director of the Office of Aging and Community Living, Director Laura Newland. Before we get started, I just want to remind everyone to please visit coronavirus.dc.gov for all of the most up-to-date information and resources available for residents. So again, that is coronavirus.dc.gov. We will now hear from Mayor Bowser.
Thank you. Thank you, Tomas. I want to thank everybody for joining this call today, and we look forward to providing you a briefing. Very clearly, this is an unprecedented situation in our city, in our nation, and indeed in the world. And it is that important that we stay connected even while practicing social distancing. First, I want to tell you about the district's overall response to the virus. Then you're going to hear from Dr. Nesbitt, who is the director of the D.C. Department of Health, or D.C. Health, followed by Director Chris Rodriguez, who is the director of the D.C. Homeland Security and Emergency Management Agency. And then Director Laura Newland will speak from the D.C. Department of Aging and Community Living. Our top priority, of course, is blunting the spread of the virus and doing everything that we can to keep our residents safe. My message to everyone in our city is very simple: be a good neighbor and stay at home. And we especially want to send that message to populations in our city who are senior citizens and people who may have underlying conditions. This is not a nice to. This is something that you must do. Stay at home to protect yourselves and your families and to be a part of how we flatten the curve. And what this means is that we're slowing the spread of the virus. In doing so, we preserve our testing supplies, our protective equipment for our doctors and nurses and first responders, and bed space and ventilator access in our hospitals. And that way, those in need of critical care will get it. This, of course, requires everyone's cooperation. The virus doesn't discriminate. Regardless of age, race, and gender, you can get it and you can pass it on. That's why everybody needs to stay at home. But we are here for you, and we're in this together. So with that, Director Newland will tell you a little bit more about our program called Call Talk. But right now, I want to turn to Dr. Nesbitt from DC Health.
Thank you, Madam Mayor. I'm so pleased to be here with you all today, having a town hall virtually, which is one of the things that we can do to have you all stay home and continue to be safe. Here in the District of Columbia, we currently have 137 cases of COVID-19 in our community. We have very porous borders with our neighbors in Maryland and Virginia, and we continuously monitor the impact of COVID-19 in the district, but also in the National Capital Region. It's critically important that we, as the mayor said, be good neighbors and stay home, and because we know that based on the experience of COVID-19 in other countries, the impact of COVID-19 on some of our more vulnerable populations, such as seniors and individuals with underlying medical conditions, they can have a more serious form of illness if they are infected with coronavirus, the novel coronavirus. And so it's particularly important for us to not only think about ourselves during this time, but think about our loved ones, our family members, our neighbors who are seniors, those who have chronic health conditions like diabetes, heart disease, lung disease, or who have immunocompromised health systems because they may be taking medications to treat cancers or HIV or autoimmune disorders. And so it's very important for us that while we think about this time of social distancing, that we also think about ways to remain connected We take very seriously some of the things that have been put in place in our community to protect our most vulnerable populations, and that we heed the impact of our social distancing measures so that we can begin to flatten the curve in the District of Columbia and to have a very responsible and responsive response to COVID-19. At DC Health, we've been working very collaboratively with our healthcare providers and our healthcare community. We know that this requires many of you to seek healthcare very differently than you maybe have in the past, but we are very grateful to you for the adjustments that you've made so far. We know that these are very challenging and unprecedented times, but the way that you have responded to our call to call ahead to your healthcare provider, to use newer technologies and have visits over the phone, and use telemedicine or telehealth, or some of you may even be receiving home visits. All of those things help you to stay safe, help our healthcare providers stay safe, and help keep our community safe during these challenging times. So I thank you again for this opportunity to be with you all today, and I look forward to this town hall.
Thank you, Dr. Nesbitt. Dr. Rodriguez?
Thank you very much, Mayor Bowser. Thank you, Dr. Nesbitt. Look forward to having a productive discussion today. And I'd like to reiterate and emphasize what the mayor said in terms of this being an unprecedented event, one that the district is marshaling all its resources to make sure that we confront and that we move forward in our strategy to flatten the curve and make sure that we stop the spread of the virus. At the Homeland Security and Emergency Management Agency, we are responsible for coordinating the district's response and supporting the D.C. Department of Health to ensure that we are doing everything we can from a district government standpoint to confront the virus. What we have done in coordination with the D.C. Department of Health is stand up our Emergency Operations Center at the D.C. Department of Health, which really allows us to have that real-time collaboration with other district agencies and, of course, with our private sector representatives as well as the federal government. So, again, under Mayor Bowser's leadership, we have marshaled all of our resources to ensure that we are confronting this new and unprecedented threat. I also want to mention, again, what the mayor has said time and time again, and that is to be a good neighbor and to stay at home. As she has said on multiple occasions, we are all in this together, and we're going to get through it together. And I want everyone to know that there are really dedicated public servants working every day, day and night, to make sure that we are getting the best information out there, that we are coordinating our efforts, and that we are on the front lines and moving very aggressively and proactively to flatten the curve. So thank you, Mayor.
Thank you. And Laura Newland is on the line.
Hi, everyone. I know it's been a trying time, and we're all still adjusting to this new normal. So even though we're working a little bit differently these days, we want everyone to know that our commitment to the community remains the same. I want to thank Mayor Bowser for her incredible leadership during this unprecedented time in our city. And I also want to thank DC Health and HCMA for their support and guidance as we continue to serve our residents throughout this public health emergency. We have 25 community partners who help us make sure that our residents do not see any lapse in our critical services. So far, we have closed all DACL-funded senior wellness centers and community dining sites. We're working daily with our partners and volunteers to deliver meals to those who are most vulnerable and to those who would normally receive a meal at one of our sites. Our information and referral line remains open Monday through Friday, 8:30 a.m. to 4:30 p.m. So please reach out to us if you're needing services and support. My team is standing by and ready to connect with you. You can call us at 202-724-5626. I want to reiterate the advice that you've heard today, that it is so important that older adults do everything possible to minimize exposure to COVID-19. Please stay home as much as possible. Avoid crowds. If you need to go out, please maintain a safe social distance of at least 6 feet away from others. Keep away from others who are sick. Wash your hands for at least 20 seconds several times a day. We know that being home alone can lead to social isolation, so we've partnered with Around Town DC to produce a list of online activities to keep you active and engaged in the comfort of your own home. You can visit aroundtowndc.org to access online programs and activities. Also, you can tune in to Channel 16 every morning at 9 a.m. to take part in a daily workout instructed by DPR's Fit DC. In addition, as the mayor mentioned, DHCL is developing a call and talk line. We'll be working with our staff and community volunteers to contact seniors on a regular basis just to chat. So Call and Talk is going to give seniors who may be experiencing isolation the opportunity to receive calls from one of our staff members or one of our volunteers. And you can talk about anything, from sports to movies, from DC neighborhoods to music, absolutely anything that you would like. Our goal is to ensure that you can still make meaningful connections and stay engaged from the comfort of your own home. We're rolling this program out today, so if you're interested in signing up for our Call and Talk line, please call us at 202-724-5626. We can't wait to talk with you. As Mayor Bowser said, we're all in this together, and we're going to get through this together. So even though it might look a little bit different, our commitment is the same. We're here for you when times are great and when times are not so great. For the latest information and resources on COVID-19, seniors should visit coronavirus.dc.gov. Thank you, Mayor.
Thank you, Laura, and that's great news about Call and Talk. Once again, you can call us at 202-724-5626 to learn more about Call and Talk.
Great, thank you, Mayor. Now we will move to the question and answer portion of the program. So if you have a question and you're on the line with us, you can press 0 now, and you'll be added to our question queue. We do have some questions that are ready to go, so we'll go first to Trina Harris in Ward 4. Trina, you are live.
Hi, Trina.
Yes. Hi, how are you? I was concerned about my taxes, my property taxes. I'm unable to meet the deadline because of this. Will they extend it for us?
Thank you, Trina. So the council, in cooperation certainly with my team, we advanced an emergency piece of legislation that was approved. And yesterday, we announced the ability to extend your income taxes in line with what the feds are doing. So your filing of your income taxes, as well as payment of any taxes due, have been extended to July 15th. At this time, we have no change to our property taxes, which become due on March the 31st. We will get up some information about any resident who may need more time to pay, and we'll have to get that information up. But at this stage, taxes on property, most people in our city are paying their property taxes along with their mortgage payments, and they're in escrow, so we expect those payments from the mortgage companies. Other people may not be in that situation and have a tax due, and it will continue to be due. We certainly will work with our chief financial officer to get out some information if you're unable to pay.
All right, we'll go to our next question. Diane Claude from Ward 2. Diane, you are live.
Yes. Is it safe to take a taxi cab? I'm worried about getting into a cab. Also, when will dental offices be reopened?
Thank you for that question, Diane. And that brings us to an order that I am making today about essential business operation in the district. Many of you have heard different measures around the country about how we can contain activity to blunt the spread of the virus. And what we've done in the district, we've done many things, including closing school buildings, and our students started distant learning today. We've had a mass gathering prohibition for a couple of weeks. And so we prohibit gatherings of 10 people or more. We close bars and restaurants. Our entertainment arenas, our convention centers, our theaters have all closed because of that mass gathering prohibition. We've also closed our public parks and playgrounds because we saw many people gathering in large groups or playing in group sports, which goes against our mass gathering prohibition. We still have seen too much non-essential activity out on the streets, and so today, in line with what's happening in Maryland and Virginia, we're prohibiting more business activity. Largely, that activity includes personal services that haven't been banned previously, like barbers and hair salons, tattoo artists, and nail salons. It will also include non-food retail, clothing stores, bicycle shops, furniture stores. Those are non-essential retailers. Essential retailers that will not be affected are food stores, pharmacies, stores where you can buy supplies for your home, like Walmart or Target. The liquor retailers, all of those retailers are included in the essential retail box. In terms of transportation services, to get to your question, taxi cabs are permitted to operate, as well as rideshare, Uber, and Lyft are permitted to operate. Our bus and rail continue to operate, although on a modified schedule. So our advice about using a taxi is to continue to practice social distancing. So to the extent that you're not, piled into a taxi with a lot of other people, that would be important. Continued hand washing, covering your cough, and those are the important things around using a taxi, and only go out if you need to go out for a taxi trip. The other thing I should remind everybody of is a lot of grocers in our area have set aside a time for seniors to shop where everybody else is not in the building. And we would suggest that you look to see if the grocer that you like has a senior time. Largely, they're very early in the morning, 6 a.m. to 7 p.m., or in the first hour of operation.
Thank you, Mayor. We will next go to our question from Gwendolyn Epps in Ward 4. Gwendolyn, you are live.
Hi, Gwendolyn.
How you doing?
Good, thank you.
My problem is I've been in the hospital 2 weeks, and I have underlying medical condition, but I had pneumonia and I had some kind of virus, and I am isolated in my own apartment, which I'm not allowed to go out. I got some stuff in here, but I can't get pretty low up. I need some toilet paper towels, and I've been trying to find out if I get low or something like that, how would I be able to get someone to get that stuff to me? Because I'm not, I don't get no meals or wheels. I don't get none of that. So I have to kind to get the stuff, the best way I can. Since I've been out of the hospital for almost 2 weeks now.
And thank you for that. I think, Gwendolyn, first of all, we're glad you're home and on the mend. And let's make sure that we connect you with Aging and Community Living to connect you with the appropriate office or resource.
Great. We'll go next to Sheila Pool in Ward 5. Sheila, you are live.
Hi.
Hi,
Good
Ms. Pool.
afternoon.
How are you?
Hi.
I'm good. I want to first thank all of you all for being available to us and with this service. It is much appreciated.
Absolutely.
And then my question is really for Dr. Nesbitt. I am just wondering, is there any chance that first of all, I'm a lifelong resident of the district and Ward 5. And in other crises, we have been, they have used crop dusters to kill off various things. I don't know if it's works for viruses, but I'm just wondering, would something like that be effective in treating this particular crisis? Something that could be done when people are not on the street, or would that be effective? And just had anyone thought of it? And maybe it won't be effective, but it's just something that came to my mind.
Yes, thank you for the question. What you're describing are the uses of what we describe as countermeasures or large disinfectant processes, and those have not been demonstrated to be effective in combating this particular virus.
Great. We'll go to our next question. Ruth Cox in Ward 7. Ruth, you are live.
Good afternoon, and I want to just say thank you for this town hall meeting. This is my first one, and I thank you so much. I appreciate all of the information that I received and what you're doing for the district. My question is, I'm in Ward 7, and I attend the Wellness Center up on Alabama Avenue. Last week, the seniors were able to go in and get free lunches, hot lunches. So we were told for this week that they would deliver the meals to us. So I was just calling to see if that still will be done.
Let me ask Director Newland to jump in.
Hi there. Yes, I would love to get your information just to make sure you are on our delivery list. But we have moved to full delivery this week. And we will be making weekly deliveries of 7-pack meals to everyone who would normally attend a site. So if I can get your information, I will follow up just to make sure that everything is on track for you.
Okay, thank you.
We'll go next to our next question. Anise Jenkins in Ward 4. Anise?
Hi, Anise.
So she just dropped off, but her question, she just flagged that she's having a little bit of difficulty getting through the unemployment system, and so just the recommendations on how to move through that system.
Well, thanks for the question about calling if you're unemployed and how to file for unemployment. You might imagine that we have been deluged with calls and people going to the website to sign up for unemployment benefits. We continue to add call capacity, a new call center, so the wait times to get through on the phone should go down. However, I strongly urge everybody who can to use the internet to sign and to enter your claim. And go to the website and use a desktop or laptop to do it, and you can file your claim online.
Great. We'll next go to Raymond Blanks in Ward 6. Raymond, you are live.
Hi, Raymond.
All right, Raymond, you are live. All right, Raymond's question is, how is the district preparing for the possibility of an influx of persons to hospitals, especially since there is not a hospital east of the river?
Well, there is a hospital east of the river, and I'm going to let Dr. Nesbitt respond to the question of medical surge, and it is a very real question. And part of the reason that we are containing all economic activity and asking people to stay at home is because if too many people become infected and need hospitalization, we have seen on other parts of the country, especially in New York, the kind of shortage for capacity, nurses, and supplies that can exist. So, Dr. Nesbitt, will you talk about our preparations?
Sure. Thank you, Madam Mayor. We have been working very closely with our hospitals and healthcare systems and other healthcare providers to prepare for a medical surge. One of our initial strategies, a part of our initial strategy, was to work with the hospitals and healthcare providers to be able to have them suspend or postpone all non-essential healthcare services and non-emergency healthcare services. What this means is that elective healthcare procedures were postponed, which allows them to have a decrease in the number of patients who are hospitalized currently. This frees up many of their resources, including healthcare personnel who would otherwise be taking care of patients who were in the hospital for elective procedures, and making more intensive care unit beds available, more ventilators available, and decreasing volume also in the emergency department. It also allows me to harken back to my opening comments about how the community has also been part of this decrease currently in our hospital volumes and ED volumes by calling ahead to their healthcare providers, getting advice from their healthcare providers, and using other technologies and strategies like telemedicine and e-visits. The other part is that many of our healthcare systems have been looking at other ways to use parts of their healthcare facilities for intensive care services or ventilator services. So parts of the what we would call post-anesthesia care units or PACUs, where patients would be recovering from surgery, how they could be used for patients who may need intensive care or ventilator services, and exploring other uses in the hospital. You may also notice that many of our hospitals have placed tents on their campus or began to do the triage for the emergency room external to the hospital, creating an opportunity to separate patients very quickly who have symptoms of COVID-19 for patients who do not have symptoms for COVID-19, further reducing the risk of transmission in our community. We have plans underway to be able to bring other services or other parts of hospitals online that are no longer being used, such as parts of United Medical Center that were no longer being used. Floors in that hospital should be coming back online within a matter of weeks. The hospital leadership there has been very forward-thinking in terms of not only how they can serve the residents of Wards 7 and 8, but how they can be an asset or resource community-wide. And then lastly, thinking about how we can activate former hospitals and health systems in the community, or even repurpose other institutions to be able to meet medical surge.
Great. We'll go next to Phyllis Canty. Phyllis, you're live.
Hi, Phyllis.
Hello, everyone, and thank you all for being present. I have a two-part question. One is about restocking supplies in the stores. I can understand people are given to taking a lot of food, but I've called around to a lot of drugstores, a lot of dollar stores and things of that nature, and asked them if they were getting alcohol in, and they said no. And I asked them, well, when the truck comes in with supplies, they say they're not even sending them in. I don't understand that. But then also my second question is this. There are some people who can't get doctor's referrals to go and get tested. One doctor, he only had one mask for his personal use, and he got frustrated and closed up his practice. What do you do in a situation like both of those, please?
Okay, thanks for that question, ma'am. And you also raised a good point that I'm going to ask Director Rodriguez to address. And because we've seen and heard a lot of people stocking up on various supplies, on food, and others may be concerned when they hear that we're closing down non-essential businesses. And so I want Chris to really talk about what we know about our food supply and supply chain, and about other cleaning supplies. And I think that's what you're referring to as well.
Thank you, Mayor. Thank you for the question. We have been in constant contact as district government with our wholesale suppliers, with the grocers associations, and what we've learned from them is that the supply of goods is not really the issue. It has been the demand, which has increased over 100% in the last few weeks as the COVID-19 emergency has unfolded. So what we'd ask residents to do when they're going to the grocery store is to buy what you need. You do not need to hoard. What's happening is that the grocery stores are selling out much quicker than they have in the past, and that is creating a challenge for the supply chain to get the needed supplies back into the grocery stores in order to resupply. So again, what we want to tell residents is make sure that when you go to the grocery store to buy what you need. Now, what we have seen is some shortages of goods such as paper towels and toilet papers. But what the suppliers are telling us is that they are working very hard, again, to get those shelves restocked and to make sure that people are getting what they need. But again, I would encourage our residents to make sure that you do not hoard and that you buy what you need at the grocery stores.
And thank you for that. And on your last question, I'm going to ask Dr. Nesbitt to respond to what we're hearing from individual practices, doctors who are practicing, in the need that we continue to emphasize of conserving masks and gloves and gowns. And that is why you have heard the direction from DC Health and others nationally that people who need to be tested are tested, but there's not a mass testing out there because of the strain it would put on these very needed supplies.
Yes, thank you, Mayor, for the opportunity to address this. We want to make sure that we are getting the testing resources and making sure we're identifying our most at-risk individuals and having them be able to access testing at the multiple opportunities available in the district for doing so. Many of our healthcare providers are working with us collaboratively, and we've hosted a number of town halls for healthcare providers, webinars, and conference calls directly by the Department of Health, as well as some of our local medical societies have done the same. What we have in place is what we call a personal protective equipment or conservation initiative throughout the healthcare system, not only in the District of Columbia, but throughout the United States. And that requires, or is why we've asked for non-elective procedures and surgeries to not occur, because those types of surgeries and procedures use personal protective equipment, and we want our healthcare providers who are on the front lines, who are taking care of COVID-19 patients, to be able to have access to that personal protective equipment. We have been working with the healthcare provider community, hospitals, primary care providers, now even home health agencies, to assess what their needs are for personal protective equipment, and where possible to be able to assist them in acquiring that personal protective equipment, so that if they have the other supplies and things that they need to test their patients, they are able to do that. We also want to make sure that people understand very clearly that physicians decide who's tested. They make that decision based on the patient's clinical presentation, often taking into consideration if they have the symptoms for COVID-19, fever, cough, shortness of breath, and based upon that, make a recommendation for testing to occur.
Great. We'll go to our next question. We have Ms. Hicks in Ward 7. Ms. Hicks, you are live.
Hi.
Ms. Hicks, you are live. All right, she was just, Ms. Hicks' question is it safe to still go to the laundromat?
Dr. Nesbitt?
So we are assessing the essential services, and we know that not everyone has the ability to launder in their homes, but we do want to make sure that individuals are still going to practice social distancing. And as we look at our requirements for the number of individuals who should be gathered in one location, we are going to ensure that the operators of laundromats and laundry services are going to be able to adhere to that requirement of the number of individuals who should be in one particular business at a time.
So thanks, Dr. Nesbitt. And so in our laundromats and dry cleaners, we'll be able to operate and just pay attention to what you've heard from Dr. Nesbitt about social distancing and people gathering inside. And so that will be our guidance to laundromat providers.
And our last question is from one of our callers. It is, how long will this posture last for? Will it go past April 1st?
Thanks for that question. And we are operating under a public health emergency. And that public health emergency now lasts through April the 24th through my current legislative authority. If we need to, we will go to the council to extend the public health emergency period. A lot of what will determine if we remain in a state of emergency is what Dr. Nesbitt and her team see on the ground in the District of Columbia. The rate of infection decreasing or not increasing at all is going to be a good measure. What we are all waiting to see is if our containment efforts here in D.C. and in the region are working. And we will begin to see that when we see the rate of infection go down. You may be seeing every night on the news the number of positive tests increasing. And none of that is a surprise. As the amount of testing goes up, we expect to see the positive test results go up as well. What we're also beginning to see and report from DC Health is the number of people who have been infected and who are now recovering. So we'll also begin to report that out. So yes is the answer. The public health emergency goes beyond April 1st. It actually goes to April the 24th. We could extend that if the conditions on the ground say we must. Part of that public health emergency means that the school buildings will remain closed except for our meal sites. Students will continue to work with their teachers and families on distance learning. And we will continue to have mass gathering prohibitions and the prohibition of non-essential business in the District of Columbia. And all of that is in effect at this time until April the 24th. And we will reassess as the weeks go along. And hopefully we'll be able to get back to school and back to business by then.
All right. Again, thank you all for joining us on the call this afternoon. Mayor, if you want to close out with some final words.
Well, let me thank you, Tomas, and our entire team. I understand that we had over 4,000 residents participate on this call, and many, many others watch on Channel 16. We recognize that, like everybody in the city, your lives, too, have been upended. I know you're missing a lot of your activities, from senior centers to churches, to visits with your grandchildren, in all of those things. But I want to assure you it's well worth it right now so that you can stay safe and that you can encourage others to help in blunting the spread of this virus in our city. I also want to let you know that it's a lot of your government is working for you right now. The folks at DACL are very focused on making sure that we're supporting seniors and providing senior services. So don't forget about the call and talk line, 202-724-5626. I think you've all seen that DPW is still out collecting your trash on its regular schedule, so I want to thank them. Our firefighters and emergency medical staff and Metropolitan Police Department are all there. Our call takers at the 911 and 311 call center are at work taking calls, making sure that the district is running. Our emergency management team at HCMA has stood up an emergency operations center, is where we're working from, and they are doing a fantastic job. Dr. Nesbitt and her entire team are at the front lines working with our healthcare providers, doing on-site visits, working with families who have been affected to make sure that we're doing all the things that we can to keep people protected. I also want to acknowledge the elected officials in our city. We're working hand in hand with the members of the council who are giving us ideas, making sure we have the legislative authority that we need, and have and keeping in touch with all of you. I had the opportunity to brief our Congresswoman today as well, and she is following all the things and resources that we will need in the district to get back to business. So these are certainly unprecedented times, troubling times, and I know that cause a lot of anxiety, but I want to let you know that we're working hard for you. And just to answer a question that I know I'm going to get later, I'm doing fine. And so we have spread out the work among us to try our very best to keep everybody safe and everybody able to work hard for you. Thank you, everybody.
Thank you, Mayor, and thank you, everybody, for joining us. And again, for the most up-to-date information and resources, visit coronavirus.dc.gov. Thank you.